Beyond Reason Radio.
Breaking news within the last hour or so. The House of Representatives on Thursday voted overwhelmingly to pass legislation providing roughly $484 billion in coronavirus relief for small businesses, hospitals, and expanded medical testing, capping weeks of contentious negotiations that had stalled Washington's latest round of emergency aid. The legislation had won the necessary majority at around 5:30 p.m. as lawmakers continue to show up in groups to vote under rules designed to keep them safe during the coronavirus pandemic. Just as a handful of conservative Republicans and one Democrat had voted against it, Justin Amash, representative out of Michigan, who's more of a libertarian, voted present. And by the way, that legislation passed the Senate unanimously on Tuesday. So that's some breaking news. Other breaking news as of today, I don't really have a lot of good news today. I'm sorry to start the show this way, unfortunately.
What a way to end the week.
I know. Unfortunately, it's just the way it is. But the Labor Department reported that the number of Americans applying for state unemployment benefits totaled 4.427 million last week. Combined with the prior 4 jobless claims reports, the number of Americans who filed for unemployment over the last 5 weeks is 26.45 million. And it's probably a lot more than that are unemployed, but these are just those who filed for unemployment benefits. That number this really puts it in perspective here. That number far exceeds the jobs added to payroll since November 2009, when the U.S. economy began to add jobs back after the recession. There were 22 million jobs added to the payroll since 2009. So we have now lost more jobs
than were created
in the
last 10 years.
The Great Recession. In just a matter of weeks, in just a matter of about a month.
No wonder so many people are trying to get things going again.
Yes, and we have to talk about that once again. This is Beyond Reason Radio. I am your host, Michael Yaffee, the voice of reason in a world that is beyond reason. We are on until 8 p.m. tonight, once again, on News Radio WFLA Orlando. We're on Facebook Live as well, and you can catch the podcast anywhere that podcasts are available. The other stat I did want to give you is, unfortunately, the United States is very close to 50,000 total deaths from this virus. And as I pointed out yesterday, just real quick, some people are saying we're just overcounting the amount of deaths. There's a chance that we might actually be undercounting the amount of deaths. In fact, there was a new study that came out yesterday, I believe, that this thing was in California since January because they started testing bodies, frankly, to see if maybe that's what they actually died of. At the time, they thought that person died of the flu. It seems that maybe a lot of those people that they thought died of the flu back in January died of this COVID-19. So the death count is awful. The unemployment numbers are terrible. And the political partisan debate, once again, is awful. Like I've said before, all you have to do is go on Twitter for just like an hour and see.
I couldn't take that.
Just see. Actually, I don't know why I said an hour. Go on Twitter for like 5 minutes.
Yeah.
And you could see that the political debates in this country over this partisan divide over this is just as terrible as everything else. So everything is a mess, unfortunately. Everything is beyond reason, but I will try to be your voice of reason through it all. And on that happy note, the voice you heard in the control room is Mr. Tom Benson. How are you, Tom? You okay?
I'm fine, except I think I probably have another tale of woe for you.
Okay. Oh, yeah, go ahead.
Gas prices, as we all know, are down, right?
Mm-hmm.
So my wife went to the grocery store today to pick out a roast for Sunday. The place will remain anonymous.
Okay.
The roast, $54. Normally, it's $15 to $20.
Wow.
$54. She went to another store, obviously. But you know what this means, though, of course. We'll be at your house for Sunday dinner.
That's what it means, huh? Okay. Well, I mean...
So the thing is, watch out for... See what happens to some food prices when this kind of tails off. I bet you they go up. They got to reclaim the money somehow.
I think the prices of a lot of things are going to go up.
Oh, sure.
You know, there's talk right now of the states who are losing revenue because of this. And they're wondering, are we going to have to raise taxes?
Or lay off some state workers.
Or cut spending?
Yeah.
The problem with raising taxes, though, is it's the last thing you want to do in a depression or a recession, because that just makes the economic situation worse. But you talked about food prices. More bad news as of today. I'm just depressing the audience today. I didn't know if this was my intention.
Yaffee, come in off the ledge, please.
Yeah, I think everyone else is going to be on the ledge. There's not going to be enough room for me. This out of Washington State, Tyson Foods Washington beef plant suspends operations after 90 workers infected with COVID-19. They're suspending operations.
That could be why the price has gone up on beef.
Yeah,
in some stores.
Beef prices are going to go up. The facility, which produces enough beef in one day to feed 4 million people.
Mercy.
In one day. Employs 1,400 workers. They've been struggling in recent days because of absenteeism, because a lot of people are catching this virus. So what's the answer here? Because when you go on Twitter and you look at a lot of the debates, there is still this debate on when we can start opening up, how we start opening up, or do we keep things shut down? And frankly, what gets me so upset when I read a lot of this stuff is people complain, for instance, of what the governor of Georgia is doing, for example, wanting to open things up. They complain about it, but then I ask them, frankly, okay, then when can we start doing this? There was an article here in CNN.com by an opinion writer, John Avlon, who said he had a whole history of when Denver backed off social distancing in the 1918 pandemic, the results were deadly, and talks about the fact that they held some kind of big event in Denver, and then they had a huge spike in cases and deaths from the 1918 pandemic. But he makes this as an example of why the protesters today are so stupid, because they want to open things up. Says, but the protesters a century ago did not have the advantages of a precedent or modern science to learn best practices. We do now, which makes the protesters who are projecting their partisan paranoid style politics on the pandemic look like members of the Flat Earth Society competing to win the Darwin Awards. This is what they think of you if you are against some of these shutdowns.
Or if you disagree with their narrative.
Yeah, of course. It's worse, of course, that the President of the United States is encouraging them against his advice of his own scientific experts. Okay, fine. So we shouldn't open things up. When can we open things up then? When? And a lot of times I read these articles all over the place. I see the pundits saying we have to keep things closed. And I'm not hearing an answer on, okay, well then when can we start opening things up? A lot of people were pointing out this week that in Florida, I think it was a couple of days ago, we had the second deadliest day in the state from this. Which, yeah, that's bad. And people say this is an example of how we're not flattening the curve. This is an example of why we need to keep things closed. DeSantis wanting to open things anytime soon would be irresponsible, yada, yada, yada. But here's the thing. While, yes, it was the second deadliest day, it's far below what they projected us to be at right now. So last Friday, projection of Florida's median deaths of 1,363, well, that'd be this Friday's projection, tomorrow, has now turned upward again, but it's still much lower than the 7,000 median deaths projected just a couple of weeks back. The current national projection falls between 45,375 and 124,118. Now, we've already surpassed the 45,000. That's by July 5th, with the median fatalities projected at 60. Okay, so the median would be 65,976 deaths is what they're projecting. But what I'm saying here is they projected Florida just a couple weeks ago. They said we were going to be at 7,000 deaths in the state of Florida. We're not anywhere close to that. So does that mean then we're flattening the curve? Or do you just look at the fact that a couple of days ago was the second deadliest day? What do you look at in terms of when we can start opening things up? And I'm not getting good answers to this, because when you look at that, it seems like we have flattened the curve. But what was flattening the curve all about in the first place? And this is something where I feel like I'm not seeing a lot of honesty out there. There's still this sort of misnomer that flattening the curve was about stopping this spread, so people wouldn't get it. That was not the point of flattening the curve. Flattening the curve was slowing the spread. And the whole point of slowing down the spread was so that you could get testing up to speed, so you could get hospitals ready, so you could get enough medical supplies out there ready, so there's enough if there's a spike somewhere. Now, according to DeSantis this week, we have more hospital beds now available than we did at the beginning of this. So if we are at capacity, if we're over capacity right now, if we have the preparations right now, then why would it be unreasonable to start slowly opening some things up? If you're going to flatten the curve, which apparently we have, we're not at 7,000, not even close to 7,000. Overall, we're pretty much plateauing the amount of cases in Florida that we know about. And the hospitals are ready and way under capacity, way over. They have more beds now than they ever did that are available to people. Then why is it so unreasonable to want to start opening things up in a safe and measured way? And I don't hear a good answer.
Well, some people think that the time to reopen things is when there's a vaccine, but that could be months away.
Yeah, and that's what I asked. When I saw that CNN article, I asked, so when do we open it? Do we wait till a vaccine?
No, I do know when. I know the date.
You go ahead.
I do.
Yes.
November 4th.
I really think so much of this is political. Now, what I want to talk about in the next segment is testing. Because what I hear a lot of people in response to what I just laid out for you is that, well, the answer is testing. What we need are more tests. I'm skeptical of that response. I think that's sort of a convenient answer for them, and I'll tell you why in a moment. I'll also explain where we are at testing, where we need to be at testing, and how exactly that would help us, and if it will actually help us. So we'll get to that next and much more. And once again, we'll defend Governor Ron DeSantis because no one else seems to want to do that, but we'll do it right here, our governor of the state of Florida. This is Beyond Reason Radio. I'm your host, Michael Yaffee. We'll be right back.
If you miss any of the show, you can download the Beyond Reason podcast on iTunes. Your voice of truth in a world of fake news. Beyond Reason Radio continues right now.
So, my sister apparently has had enough of staying inside.
Uh-oh.
She still has to work sometimes for her essential business. Mm-hmm. But I'm just watching her on Facebook. I don't even know if she's listening. But she's like gone on an adventure today, looking at weird historic things throughout Central Florida. So she went to the first public supermarket, which I guess is in Winter Haven, and posted the picture of that. It doesn't look like it's open, but they have like a historic sign that's where it was. And she went to Spook Hill in Winter Haven and is like driving around. I just want to point that out because it's actually kind of an interesting idea if you're looking for something to do, because there seems to be more and more evidence that going outside is good for you to help fight this pandemic, that being out in the sun and exercising, going and doing things outside is a good thing. So I don't know. I just thought that was a interesting little idea. Welcome back to Beyond Reason Radio. I am your host, Michael Yaffee. In the last segment, we were talking about, once again, the frustration I have when it comes to the Beyond Reason debate over shutdowns versus no shutdowns. And the reason why I say that is Beyond Reason is still, when I go on Twitter, it's being framed in a way that I don't think is correct. Most people I talk to are not saying we should just open everything up. But it's being framed by the pundits and everything that there's two groups, one who wants to shut everything down and one side wants to just keep everything shut down and one side just wants to open everything up. I'm not hearing that. Even the governor of Georgia, who's opening up a lot of things, is not opening up everything and not implementing other regulatory policies to make sure that there's social distancing and guidelines in place for those businesses that are opening up. But it's being portrayed by some on the left that these people who are protesting are just Nazis or waving Confederate flags and don't care about human lives and all that stuff. This is dishonest. I can't take your argument seriously then about being against the protesters because you're being dishonest. The vast majority of protesters were in their cars. The vast majority of protesters were not waving Confederate flags. There was like just a couple. They were waving American flags. The vast majority of protesters were not waving Nazi flags. In fact, it was a Bernie Sanders supporter who went to a rally and waved a Nazi flag, ironically, to criticize Trump. It wasn't some Trump Nazi supporter doing that. So this is being framed as these protesters are just all crazy racist nut jobs, but that's not the case. When you have 26 million people who are unemployed, obviously people are concerned about their livelihoods. And I hate how this is being framed. But I always ask the question then, to people who want to keep things shut down, it's the simple question, then when can we start reopening? When? Because we have flattened the curves. We have started to flatten the curve. The hospitals outside of New York City are not overwhelmed. We have more materials. We have more tests. When can we start having a phased approach to reopen? And a lot of people tell me, oh, well, we just need more testing, more testing. Well, they never tell me how much testing. How much testing then? So there's a couple of different theories here. There was a study out of Harvard, the Harvard Global Health Institute. They said that at least 500,000 tests are needed per day to start reopening the economy.
Per day?
Per day.
Okay.
Now, that's not totally unreasonable. Right now, we're about at 150,000. That's about 1 million tests per week. 500,000 a day, it'd be close to 3 million tests or so, 4 million a week. From what I understand from Scott Gottlieb, who's the former FDA commissioner on the task force, been really good on all this. He says in the next couple of weeks, we'll be pretty close to having 3 million tests per day. So in the next couple of weeks, we'll have enough according to this study. And the reason why you want that is so you can highlight the hot spots and contain the hotspot areas while opening other things up. But the reason I point this out is I just want to see then, when we get to 500,000 tests a day, I want to see these people that have been saying, okay, that's all we need to open up. I want to see what they say then when we get to that point. Are they going to start saying we should start opening up?
They'll move the goalposts some other direction.
I have a feeling that's exactly what's going to happen because so much of this is just based on your group bias. Now, there was another idea out there from another study that said it was a Harvard University Edmund Center for Ethics Studies said we should do 5 million tests a day. And no, actually, I'm sorry, 20 million tests a day to reopen safely. This study says we need 20 million tests a day. And I have a feeling a lot of people on the left are saying, yep, that's exactly what we need. Is that realistic? How long is it going to take to ramp up testing capacity in a country of 300 million people to be able to do 20 million tests a day? Are we really going to wait until August, September, until we start opening up the economy? We're just going to keep things shut down until then? That seems completely unrealistic to me. But I guarantee you that's where it's going to be. Now, so as I mentioned, we've done about 40, almost 5 million tests in this country. And a lot of people say we need to be like these countries in Europe who've done a lot more testing. And they always give Germany as an example. We have to remember Germany has a lot lower population. So they are able to test more of their population because they have less people. It's much easier for them to do that. I'm not saying it's totally easy. And they were ahead of the curve, and we did mess up testing in the beginning. And I'm not saying we shouldn't do more testing. We definitely should.
But how much?
But I just have a feeling it's never going to be enough for a lot of those on the left. But even Germany, who has done a lot of testing, they've done about 2 million tests total since this started. We've done close to 5 million tests total. So we've done a lot of testing. It's going to be difficult, if not next to impossible, to do 20 million a day within the next couple of months. But we can't keep the economy closed for the next 2 months. So why is it so unreasonable to have a measured approach to this and start reopening some things, now that we know more about how this spreads and everything else, while also having social distancing and other things? I don't understand this. And I think it's just fear. And the problem also with more testing is if you do more testing, you're going to find out more people have it, and then more people are going to be afraid to go out, and then we're going to hear more about how we need to stay indoors because, the number of cases have gone up. Well, the only reason they're going up is because of more testing. So I'm just not hearing good solutions by some of these people. And it frustrates me every day. Continue this conversation in just a moment on this edition of Beyond Reason Radio.
If you heart Beyond Reason Radio, listen to the Beyond Reason Radio podcast on iHeartRadio. Just download the iHeartRadio app and search Beyond Reason Radio. Your safe space for conservative thought, not for political correctness. Yaffee is back right now.
Yes, welcome back to the show. This is Beyond Reason Radio. Don't forget that you can like the Beyond Reason Radio Facebook page. Follow me on Twitter at Michael Yaffee. You can see all the lefties who like to troll me. And you can listen to the podcasts, any of the podcasts, anywhere podcasts are available. Best way to get it, download the iHeartRadio app. So we've been talking about this continued debate over shutdowns versus not shutting down. And one thing that has really frustrated me is that many on the left and in the media are blasting these protesters. And they do it by maligning them in a way. So they put a caricature of them, sort of. And I've seen this, literally seen this.
They're stereotypes them.
That was the word I was looking for. They're stereotyping them.
Yeah.
And I've seen people do this on Twitter. So they say that these protesters are just waving Confederate flags, that they just want to be able to get their hair cut. That's all they care about, that they're not social distancing, that they're racist nut jobs and all of that stuff. And when you have 26 million people unemployed, I really think that's unfair. Obviously, the vast majority of them are not that stereotype. And if you actually look at the overall protest, you can tell, especially since most of them have been doing it in their cars and waving American flags. And they just want to be able to work because they're worried about their businesses failing or that their jobs are never going to come back. And it's so insensitive, I think, to just say, oh, well, they don't care about lives. And when I point stuff like that out, it's just, oh, you just care about money and the bottom line, and you're willing to sacrifice lives.
You can't win, you know?
It's foolish. It's just foolish.
Sure.
It is tragic how many people are dying. It really is. And you're seeing more and more, like Maxine Waters, Democrat. She came up today and she said her sister is dying from this. Elizabeth Warren, senator, said her brother died of this. I mean, it's just awful to hear that stuff. It's tragic. Nobody wants to hear that stuff. But this whole approach that, well, if you just can save one life, then it's worth doing, then we have to restructure way more things in our society for way more reasons than just what we're doing now. There's a lot of things that hurt people in our society that we still allow. And this whole premise that, oh, well, if we could just save one life, under that premise, we would have to ban cigarette smoking. If we could just save one life.
Ban cars.
You'd have to ban cars. You'd have to ban hard food so people don't choke, I guess. We'd all eat applesauce all the time. I don't know.
And oatmeal.
Yeah, I mean,
Yum.
It's obviously just a way to make yourself look better than everyone else and more magnanimous than everyone else without being realistic. Now, one person who is doing this, of course, is the governor of New York, who the media just love, even though he is the worst hit state, and he was late in a lot of this. Andrew Cuomo was asked about, well, what about the economy? And his response is, yesterday I read that piece on how there's really no sympathy from those who are still working in the media and on the left in these governors. There doesn't seem to be any sympathy at all for those who are losing everything. This is a great example of that. Here's Andrew Cuomo.
I don't know if you can hear, but there are protesters outside right now honking their horns and raising signs. We did speak to a few of them before we came in, and these are regular people who are not getting a paycheck. Some of them are not getting their unemployment check, and they're saying that they don't have time to wait for all of this testing, and they need to get back to work in order to feed their families. Their savings is running out. They don't have another week. They're not getting answers. So their point is the cure can't be worse than the illness itself.
Yeah.
What is your response to them?
The illness is death. What is worse than death?
Well, what if somebody commits suicide because they can't pay their bills?
Yeah, but the illness is maybe my death as opposed to your death. They said the cure is worse than the illness. The illness is death. How can the cure be worse than the illness if the illness is potential death?
But what if the economy failing
Worse than death?
Equals death because of mental illness. The people stuck at home.
No, it doesn't. It doesn't equal death. Economic hardship, yes, very bad, not death. Emotional stress from being locked in a house, very bad, not death. Domestic violence on the increase, very bad, not death. And not death of someone else. See, that's what we have to factor into this equation. Yeah, it's your life, do whatever you want. But you're now responsible for my life. You have a responsibility to me. It's not just about you. You have a responsibility to me, right? We started here saying it's not about me, it's about we. Get your head around the we concept. So it's not all about you. It's about me too. It's about we.
I just want to point out that almost every dictator, tyrant in the past used that last line to justify what they were doing. Well, I'm doing all these things that are taking away your rights and liberties, but it's about we. It's about the collective. So I just want to point out that's not a good enough answer to say it's about we. But he said the whole thing's illogical. To act like total economic collapse could not possibly cause more deaths in the long run than the virus is absurd. Of course that could happen because our lives are dependent on a functioning economy. Our lives are dependent on a functioning economy. So he's out there saying, well, economic hardship's bad, but it's not death. What about the people that committed suicide? Well, they chose to do that. So who cares about them? Doesn't affect me. You have to look at the big picture. Under his logic, we would have to ban a lot more things all the time. It's nonsense. And I'm not saying we shouldn't be taking steps. New York City probably should be shut down. What they really should do is shut down the subways because that's probably where most of this spread. But the fact is, under his thinking, we're never going to reopen. Under that kind of thinking, there's no way we could reopen. Now, I want you to this is why I'm thankful of our governor, Governor Ron DeSantis, even though a lot of the media are blasting him, even though, as I pointed out, they expected Florida to be a lot worse than it ended up being. And a lot of these other states who shut down earlier are a lot worse than Florida ended up being. But Governor DeSantis, I think he's been pretty good, pretty reasonable, not perfect. The unemployment system is still a disaster in this state. But he was on Hannity this week, and he was talking about how all these dire predictions that didn't come true in the state of Florida. Here's what he said.
Well, you're right, Sean. People were predicting us to be worse than New York, like another Italy. They said that this week, one of the newspapers in Florida said we'd have 464,000 people hospitalized. The actual number's 2,200, so we beat that by 462,000. But what we did very early was focus on the populations who were most at risk, as you mentioned, our senior citizens, and particularly our nursing homes and assisted living facilities. We instituted screening for all staff immediately. We stopped visitation. We required all staff to wear N95 masks. I charged the National Guard with doing strike teams to do spot testing at the facilities to try to figure out if any of the staff are asymptomatic. Whenever there was an incident at a nursing home, we send these quick response teams to go and try to limit the infections. And so we focused on a laser.
So I really like what he said there. It's pretty reasonable. And he also says here in this next cut that we didn't have to take the most drastic, draconian measures to get this done. Here's what he said.
And here's the thing. You don't have to be draconian. At the villages, they're playing golf just like they always do, but they're doing it with social distancing. So they don't share a cart with anyone. They don't touch the flag stick, and they've ended up doing very well. The president tweeted congratulations to them. So I think it's been a team effort here in Florida. We got a great public health people at the county level. We've worked very good with the local governments as well. We still got more work to do, but clearly we've done way better than all the experts said we would, and I think we did it by a smart, data-driven approach.
So there you go. And he's been blasted by a lot of people in the press, by a lot of Democrats, by a lot of the Twitter trolls and all of that stuff. But the fact is that what he said there is going to have to be our approach. Most of what he said there is the smart approach, and it's going to have to be our approach within the next couple of months because you can't keep things completely shut down for months and months on end. So what did he do? He did targeted approaches to the most vulnerable communities without draconian measures by protecting the most vulnerable, making sure they had the most materials, while also putting social distancing guidelines in place in those areas. And you have social distancing guidelines in a lot of other areas. He did all this before we shut down. And that kind of approach is what we're going to have to do to start opening up, protecting the most vulnerable the best we can, while also phasing in gradually some openings, while also having enough hospital beds, which he says we have more than we've ever had available right now, while also being smart in our society. It's a reasonable response, and as much as he's being blasted, what he said there is what we're going to have to do. It's just the reality of it. So there was something that came out of the the Congressional Payment Protection Program plan. That is just an example of what they call perverse incentives. So we'll talk about that next. This is Beyond Reason Radio. I'm your host, Michael Yaffee. We'll be right back.
Listen to the latest episodes of Beyond Reason. Download the podcast at Spreaker.com. This is Orlando's Smart Talk Radio. Beyond Reason Radio continues now.
Well, here is a headline that's not going to make you feel any better. Kind of hits my heart, too. But here's the headline, because this is something I like to do. Our restaurants can't reopen until August.
Really?
That's what the headline says. This is an opinion piece in the Wall Street Journal by Kurt Huffman. It says employees refuse to work as long as they're getting an extra $600 a week. This has to go with what I talked about, perverse incentives, which, every time conservatives and libertarians bring this up, those on the left say, you just don't care about the poor. And it's like, no, there is something called moral hazard that when you give perverse incentives, it can encourage people not to work. That doesn't happen. It says, my company works with the local chefs to open and operate their restaurants. We are currently a partner in more than 20 of them. We closed our dining rooms March 15th, 2 days before the governor mandated we do so, had to lay off 700 employees. We are doing our best to stay alive by providing takeout and delivery service at about half our restaurants. It says, although our limited operations leave us at only 30% of our usual revenue, takeout and delivery has worked better than expected. After 2 weeks of getting the systems in place and understanding the challenges of a different business model, we realized we needed to hire back some of our staff to help with the demand. You'd think this is a good thing, right?
Sure.
Great. We can get these people back to work. They lost their jobs. But here's the thing, that proved harder than expected. We started making the calls last week just as our furloughed employees began receiving weekly federal pandemic unemployment compensation checks, $600 under the CARES Act. When we asked our employees to come back, almost all said, no thanks. If they return to work, they'll have to take a pay cut. This is the problem, and a big problem that has come up under this bill, the CARES Act. It says the starting wage for a line cook in one of the restaurants is $15 an hour. These cooks receive at least $1 an hour in tips, so at a minimum they make $16 an hour, or $640 before taxes for a 40-hour week. The overwhelming majority of our laid-off cooks qualify for Oregon's unemployment compensation at 1.25% of their annual gross wages weekly, or $416 in our example. The extra $224 a week provides a strong incentive to return to work. But as of this week, the same employees receive $1,016 a week, or $367 more than he made as a full-time employee. Why on earth would he want to come back to work? So we've created another system now through this that is encouraging people, and these are essential people that we need out there. Now we're encouraging them not to work. Perverse incentives. There's also another story out of CNBC where a business owner received loans from the Paycheck Protection Program. Her employees hate her for it. Says she halted pay for 35 employees, including herself, at Oasis Med Spa and Salon in Woodinville and a couple other spas. She says, when Black Lewis convened a virtual employee meeting to explain her good fortune, she expected jubilation and relief that paychecks would resume in full, even though the staff couldn't work. She got a different reaction. It was a firestorm of hatred about the situation. Why is that? It says here, let's see. The anger came from employees who determined they'd make more by collecting unemployment benefits than their normal paychecks. There's countless examples of this, where we created a program so employers could continue paying their employees, and now they don't want to be paid because they're getting more off of unemployment. This is just going so splendidly. Should we end with something that made Yaffee laughy?
Oh, my goodness.
Should we do that? I didn't really warn you.
I kind of thought that was it, but we didn't do it. We didn't make it official by playing.
There it is. All right, and once again, it's from our good friends at the Babylon Bee. Why not?
Goody.
They put out this little thing that's really funny. It said COVID-19 talking points translation guide. So you hear the talking points, and they give you the translation of what it actually means.
That comes in handy, I'm sure.
Talking point number 1. Shutting down the whole economy could have some bad consequences.
Oh.
That's the talking point.
Translation is?
Translation, I want people to die. So, there you go. This is according to the left, apparently. I'm a little worried. This is talking point number 2. I'm a little worried about government overreach. Translation, I want people to die. So when people say that, they just want people to die, right?
Sure.
It's from the Babylon Bee. Talking point, what about my constitutional rights?
Translation,
I want people to die. You laugh because it just rings true. Talking point, the virus originated in Wuhan, China.
Ooh, translation,
I want people to die, and also I am a racist.
Of course.
Talking point, Trump has managed this situation fairly well.
Translation,
I want people to die as I worship at my shrine of Trump. Talking point, the WHO kind of blew it on this one.
Translation,
I want people to die and I hate science. Talking point, I sure would like to go for a jog today.
Translation,
I want people to die so I can jog over their lifeless bodies. I knew that's what they really meant. And last one, talking point, stay the blank home.
Translation,
I have an unlimited love for the humanity, and I believe together we can end death for good. So there you go. The Babylon Bee giving you some much-needed translations to the talking points out there. Unbelievable. But that's how the left really thinks of you when you say this stuff. So that's why you're laughing. I appreciate you listening to the show. I hope you have a wonderful weekend. My birthday is this weekend. I turned 34. I'm getting old. It's just weird. So I appreciate you listening. Check the podcast anywhere podcasts are available, and I'll catch you guys next time.